Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Cardiovascular drugs. Raymund is reviewing on cardiovascular drugs for his upcoming exam. For a well-prepared student, he should know that vasodilators are agents that Option A. Relax smooth muscles. Option B. Are used to treat hypotension. Option C. Stimulate the adrenergic receptors of peripheral sympathetic nerves. Option D. Cause respiratory depression. Right answer is Option A. Relax smooth muscles. Vasodilators relax smooth muscle. They are used to treat hypertension, not hypotension. Stimulating the adrenergic receptors of peripheral sympathetic nerves causes blood vessels to contract. Choice D is not an action of vasodilators. As a competent nurse, you are aware that vasodilators are used mainly to treat Option A. Diabetes. Option B. Hypertension. Option C. Atrial fibrillation. Option D. Hypotension. Right answer is Option B. Hypertension. Vasodilators are used to treat hypertension. They are not used to treat diabetes. Atrial fibrillation is not treated with vasodilators. Vasodilators are not used to treat hypotension. The drugs used most commonly to treat peripheral or cerebral vascular obstructive diseases are Option A. Pentoxifylline, Trentil. Option B. Cyclandolate, Ciclin. Option C. Isoxaprine, vasodilators. Option D. All of the above. Right answer is Option D. All of the above. All are vasodilators used primarily to treat peripheral or cerebral vascular obstructive disease. In a 50-year-old widower who had a transient ischemic attack, what is the most common vasodilator used for his treatment? Option A. Norepinephrine. Option B. Dopamine, Intropin. Option C. Papaverine, Pavabid. Option D. Nitroprusside, Nitropres. Right answer is Option D. Nitroprusside, Nitropres. Nitroprusside, Nitropres, is used in this situation. A and B are sympathomimetics used to treat hypotension. Papaverine is contraindicated in myocardial depressant states. For a client taking drugs to treat peripheral vascular disease, it is important to provide health education about Option A. Smoking cessation. Option B. Developing a proper balance between rest and activity. Option C. Proper foot care. Option D. All of the above. Right answer is Option D. All of the above. An important component in the treatment of peripheral vascular disease is health education on preventing further injury to ischemic tissues. Medication therapy is only one aspect. A clinical instructor asks a nursing student about aldosterone antagonist. The student is correct by saying that aldosterone antagonists Option A. Create an osmotic gradient. Option B. Inhibit the exchange of sodium for potassium. Option C. Cause metabolic acidosis. Option D. Work poorly in the presence of endogenous aldosterone. Right answer is Option B. Inhibit the exchange of sodium for potassium. Aldosterone antagonists compete with endogenous aldosterone and prevent sodium reabsorption in exchange for potassium elimination. Aldosterone antagonists work on inhibiting the action of aldosterone rather than creating an osmotic gradient. Aldosterone antagonists do not cause metabolic acidosis. Aldosterone antagonists must work in the presence of endogenous aldosterone. Which of the following is a potential side effect of furosemide, Lasix? Option A. Drowsiness. Option B. Diarrhea. Option C. Cystitis. Option D. Hearing loss. Right answer is Option D. Hearing loss. Patients receiving large doses of loop diuretics are at risk for developing ototoxicity. A 68-year-old client with a history of mild CHF and glaucoma is receiving 4-mannitol, Osmitrol, to decrease intraocular pressure. The nurse would monitor the client for signs and symptoms of Option A. Fluid volume excess. Option B. Fluid volume deficit. Option C. Hyperkalemia. Option D. Hyponatremia. Right answer is Option A. Fluid volume excess. Mannitol's osmotic effect extends to the bloodstream, where increased osmotic pressure draws fluid into the vascular space, thus elevating intravascular volume. All potassium-sparing diuretics, Option A, are required supplements during blood transfusion. Option B, enhance aldosterone action. Option C, cause hypokalemia. Option D, are weak diuretics. Right answer is Option D, are weak diuretics. Potassium-sparing diuretics are not potent diuretics when used alone. They are used as adjunctive therapy with other diuretics to minimize potassium loss. Potassium-sparing diuretics given during blood transfusions tend to cause hyperkalemia because potassium is present in the transfusion. These drugs block aldosterone's effects. These drugs cause hyperkalemia, not hypokalemia. Which of the following clients is most likely to experience adverse effects from treatment with diuretics? Option A, a 21-year-old student. Option B, a 40-year-old unmarried man. Option C, a 60-year-old widower. Option D, a 75-year-old man. Right answer is Option D, a 75-year-old man. Elderly clients are more sensitive to the effects of diuretics. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.